Okay. Well, thank you. So one thought occurred to me, and if we take 5 steps back and think, why is this discussion even necessary? Isn't it a bit of a no-brainer that when these awful things happen to kids and we think of all the implications, why is this the good fight that it is? That it should almost be redundant and that one would hope people would be on the same page, but apparently not. So, with that in mind, let me see. I was asked, what is the message for the healthcare system? And as a pediatrician, there are too many days, too many weeks where I'm seeing a child who's been abused, who's been neglected, seeing the consequences of that. And so for the healthcare system, what would be the compelling case to make to convince folks that this is a health issue and that the healthcare system has to be part of this good fight? So as we've heard, it's a very common problem. In fact, some of the stats after all these years, I think, are still mind-boggling. We have about 75 million children in our country. In 2016, about 7.5 million kids reported for possible abuse or neglect. So we know the problem is of a staggering dimension. We've heard, and in the brochure as well, lots of data about the many possible terrible outcomes, sometimes for a lifetime. What's also important to recognize, by the way, it's not just the abused or neglected child who is hurt, but so often the siblings, others in that home, are also affected by what happens. And so the repercussions are just enormous. There's the immense cost. There's the human cost, but also a financial cost. And so when you think of all these outcomes, children not learning well, the criminal justice system, child welfare, the healthcare system, a child in the ICU, it's not shocking that we are paying a huge price as a country for this problem. But I think perhaps the most compelling reason of all is a moral one, that kids really suffer, and sometimes that suffering endures. And just for that reason, I think we have such a strong argument of why we're here today and why really let's hope that this campaign can achieve the vision that it has. So I was heartened to see some of the stats that Mary showed earlier, and people showing, for example, that that it is a public healthcare system. There was one stat that I'd love to see, though, and that is, what do you think can be done? Because I think we've reached a point where there's a nice level of awareness, a high level of awareness, but is there a conviction that yes, we can do something about it? That's a little different. And so as a pediatrician, I'm going to give an example of how the primary healthcare system can really make a difference. And for those of you with kids or grandchildren, you'll remember all those visits when you took your kids for shots and other things to the pediatrician and nurse. Why is this a terrific opportunity? For one, it's in place. It's well institutionalized. Most parents know that they need to take their kids there for those visits. And especially in the first few years, there are lots of these visits. The goal of prevention has been an integral part of that whole healthcare system, because you have an adorable 4-year-old walking into the office without any problems. And the idea is to see, is there something in that child or that child's environment that poses a risk? And the concern for the child and family has actually been something we've talked about for a century. one of the advantages we have in the healthcare system is that usually there's a really nice relationship between pediatricians, nurse practitioners, and parents. And that trust, that cred, offers us a remarkable opportunity to know what's happening in the family and to help when help is needed. And so unlike colleagues in child welfare, maybe in mental health, we don't have the problem of a stigma. In fact, the stigma might be when a parent does not take their child for that care. So all of this adds up to a wonderful opportunity to know what's happening in a child's life, and arguably with that opportunity, a responsibility to help again when help is needed. So I want to just very quickly point to an example of what can be done in the healthcare system. And this is a model that we've developed at the University of Maryland over about 18 years. And it's actually a very simple idea. It recognizes the opportunity that we have and how can we train these professionals to seize that opportunity. Now, many pediatricians, for example, were not trained on how to approach a depressed parent. And so that's an example where extra special training is needed. Practices are moving at quite a clip, and so having... So am I.
Yes.
I need to end.
Keep clicking.
Okay, clipping or clicking along. So, so they need a tool that parents fill out while waiting for the appointment. And then the idea is simply that when a parent on this screening tool discloses that they may be depressed, that there is a brief assessment and followed by some initial help. That's the simple idea. And ideally, this all works best when we have medicine well integrated with behavioral health, having social workers, mental health professionals as part of the team. It requires being savvy about what's out there in the community, because if someone has a substance abuse problem, where are you going to refer them? And then some parent handouts to support what was said in the office. So we have tested this model in 2 big randomized clinical trials, and the results have been really quite encouraging in helping prevent kids from being abused or neglected. I better finish. What to do? What next? So to disseminate and implement what we know, it's been said the tragedy is not what we don't know, it's how we ignore what we do know. There are things that we could be doing today that are not being done. At the same time, clearly, we do have to develop new strategies, new interventions. There are some things to learn. And so it comes back to funding. There's no way of escaping that this is not the whole story, but it is important. And so the funding for research in this field has not been great. And also there's the issue of health professional reimbursement. The reimbursement is pretty puny, and so this is a barrier to the healthcare system and physicians taking on a broader role that will take more time. And because of where we are, we really need the help of the media to educate policymakers, leaders, the public, and to make ending child abuse the priority that it needs to be, and to understand that if we are committed with conviction, this is something that we really can do. Thank you.
Thanks.